Another major role of serotonin in the body is its influence on our vasculature. It is a vasoconstrictor, which is, again, we want all things in balance. We don't want them constricted all the time, but we don't want them massively dilated either. A lot of the times you see that vasodilation or that vasospasm seen in things like migraines. That's why a medication falls in the class of the triptans, or sumatriptan can be effective in addressing migraines to a certain extent, because what they do is they stimulate that serotonin receptor, perpetuate vasoconstriction, and potentially quell those detrimental effects of a migraine, a vasculature migraine, that's causing the vasodilation and the irritation to the brain. Sometimes people see the migraine phenomenon associated cyclically or with their monthly cycle, their period. And sometimes, depending on when it occurs, it may be actually a product of serotonin fluctuations rather than the estrogen. You see, when estrogen drops during the cycle, it drops quite dramatically right after ovulation. When that happens, there's a concurrent drop in serotonin. When that serotonin drops, all of a sudden, you can see a loss of that vasoconstriction, and you can see the vasodilation of the blood vessels in the brain, vasospasm of the blood vessels in the brain, and now all of a sudden you have a seemingly hormonal migraine. Now it's true, it may coincide with a certain period, a certain time frame that coincides with that post-ovulation error, that post-ovulation period of your cycle, but it might be indirect from that estrogen dropping and then bringing down the serotonin as well, thus leading to the vascular effects. That's something to think of, because what serotonin does when it does drop as well, it leads to a heightened sensitivity of the meningeal nerves of the brain. And if there's a heightened sensitivity of it, all of a sudden we are now more sensitive to pain. All of a sudden we have a lower pain threshold, if you will. It increases something called substance P. Substance P is something that occurs that can lead to this vasodilation that we talked about right there, that increase of blood flow. Substance P is seen with pain. It's associated with pain, substance P. When serotonin drops, the substance P goes up, so it's something to think about. Pain being experienced in the brain and the central nervous system, but also throughout the rest of the body. It's something that serotonin plays a major role in. So again, another potential area that we can improve by making sure we have adequate serotonin levels. Limiting the tryptophan steal, what we've been talking about. Power is in our hands. It's exciting, it's empowering. Possibilities are endless.